and welcome to a very special LinkedIn and Facebook Live today. My name is Marie Manning. I handle marketing communications for the Training Services Division here at the Red Cross, and I'm joined today by two members of the Sudden Cardiac Arrest Foundation, and I think we're going to have a very informative and inspiring talk today. Before we get started, if you'd like to tell me where you're tuning in from, that is always a fun way to get to know our viewers. I'm coming in here from Alexandria, Virginia, just across the river from Washington, D.C. Joe, Gina, where are you coming in from?
I'm in Incline Village, Nevada, on the north shore of Lake Tahoe.
All right.
And hi, I'm joining from Del Mar, New York, which is upstate New York, right outside of Albany.
Fantastic. Well, today is a special day. It is World Restart Heart Day, which is an effort that started up within the past decade, and it's to really encourage people to learn CPR, specifically hands-only CPR, so that you can, in an emergency, respond. This whole month is also Sudden Cardiac Arrest Awareness Month, and that's why today we are here with Gina and Joe. So, did you know that every year more than 350,000 people suffer in out-of-hospital cardiac arrest? We distinguish out-of-hospital from in-hospital because the care required, immediate CPR, use of an AED, that's the same, but the skill level of those responding is different. So in a hospital environment, of course, these folks are trained, they're trained on advanced resuscitation techniques. But if you're like the 70% of the cardiac arrests that happen in the home or out of hospital environment, the person saving the life of someone in cardiac arrest could be a friend or a loved one. So sometimes it could be a complete stranger as well. So we're here today to talk about that and to get you familiar with the concept of cardiac arrest and CPR. And we hope that you will learn a few things as you join us in this journey. So we have a lot to cover today. It's very exciting. And I'd like to have Joe and Gina introduce themselves. So Gina, I'm going to have you go first. If you could just give us a quick snippet of the work you do at the Sudden Cardiac Arrest Foundation and your background, that would be fantastic to start off.
Sure. Well, thank you so much, Marie. It's great to be joining you today. So I'm the executive director of the Sudden Cardiac Arrest Foundation, or SCAF for short is our acronym. And our mission as a national nonprofit organization is to raise awareness of sudden cardiac arrest and promote initiatives that help save lives through education, research, and community. And our vision is to eliminate death and disability from sudden cardiac arrest, as well as support those who have been affected by sudden cardiac arrest. I know that we're going to get into the programs in our discussion, so I'll talk about those in a bit. But my personal background, professionally, I have lots of experience working in the patient advocacy community, so working in nonprofit management for all of my career. And then I also have a personal connection to this work with a family member who lives with a cardiac condition that puts him at greater risk for sudden cardiac arrest. So he lives with an ICD to help mitigate the risk for that. But sudden cardiac arrest is always top of mind, both personally and professionally for me.
All right, it's so great that you get to work in a field that's both, is a passion of yours, and I know that with Joe, we're going to hear about his passion. It comes from personal incident. So, Joe, similar question for you. Tell us about yourself and briefly so that our viewers know who you are and have a connection to you. And how did you get involved with Sudden Cardiac Arrest Foundation?
Well, a little bit on my background first, Marie, if that's okay, is that I'm a retired doctor of physical therapy and practiced for 42 years. As did my wife, Edie. And so we've been trained in CPR for 50 years as healthcare providers. And We've been instructors the last 18 years since my survival of sudden cardiac arrest. And I've saved 2 lives with CPR. It works. And my life was saved by CPR, and I'll get into that a little bit later. But how did I get involved with Sudden Cardiac Arrest Foundation? Mary Newman, who's our former CEO, approached me in 2015 for Edie and I to speak at an AHA conference, which we did. And after our speech, she said, what are you doing in your spare time? I go, I don't have much. So she said, well, would you consider joining our board of directors, which I did. I've been a member of it since 2017, and I currently serve as the chairman or chairperson of the Sudden Cardiac Arrest Foundation. And Edie and I are paying forward. I'll tell you about that a little later. Thank you.
Good. Okay. Well, Joe, we're going to get to your story in just a bit. But Gina, first, I want you to tell me, the foundation is all-encompassing in that it supports survivors, it supports families, communities, and individuals. So tell me what it is that you do, and then I'd like to hear a little bit about Ready to Respond, this training week that you're having, because I mean, it's very timely.
Yeah, of course. Thank you. So in terms of supporting patients and survivors and families, we have a program called CASA, the Cardiac Arrest Survivor Alliance, and that is our peer support online community. And so that is for anyone who has been impacted by sudden cardiac arrest can join. There's no charge to join. We have over 2,000 members currently. Most of our members are sudden cardiac arrest survivors themselves, but we also have separate discussion forums for co-survivors, family, friends, loved ones, as well as lay rescuers and advocates as well. So there's an opportunity for people to join that online community, connect with other people who have been through sudden cardiac arrest. We also share information and resources there. We host educational webinars with medical experts. We host virtual meetups for members to connect with each other. And we also work with researchers to do studies that are focused on post-resuscitation quality of life. So on kind of the public awareness and education side of things, our Ready to Respond campaign. So a lot of what we do is focused on public awareness and reaching other people to let them know about the importance of knowing what sudden cardiac arrest is, as well as knowing what to do in the case of an emergency. And so Ready to Respond is a new initiative this year. We're really excited about it. And it's part of our Sudden Cardiac Arrest Training Week, which is happening right now. We're in the middle of it. So Sudden Cardiac Arrest Training Week is the second week of October. And it's basically, the idea is to host trainings and Ready to Respond events throughout the country to let people know our tagline for the campaign is learn the facts, gain the skills, save a life. And so that's really our goal. It's simple, is to teach people what sudden cardiac arrest is, how to recognize it, and knowing what to do, gain the skills, in the case of needing to respond. So teaching them how to do CPR, how to practice compressions, hands-only CPR on mannequins, how to use an AED. And so we have over 80 events registered with us this week. So we're really excited that we've had such a great positive response. So those are happening across the country right now. We have some event hosts are bringing training into their groups. So workplaces, schools, college campuses, scouts, programs like that are training in. And then we have other community activities that are hosting trainings that are public, and so in high traffic areas where people can be out and about and kind of happen upon a training and stay for, join the table, learn about sudden cardiac arrest, learn about how to do CPR, practice compressions. And so just really trying to equip people with the skills and the confidence to know what to do in the case of a sudden cardiac arrest.
Right. And speaking of knowing what to do or having people know what to do in the case of cardiac arrest, I want to turn to Joe because I think he has a very compelling story to tell as a survivor. So Joe, tell us what happened to you and what we can learn from it.
Well, as a precursor to my story, I'm a golfer. And in August of 2007 in Incline Village, Nevada, where I live now, I saved a man's life on the 12th green with CPR. And that's a pretty big eye opener. It's the first time I ever performed CPR on a victim in cardiac arrest. And thank the Lord, he survived. Ironically, a year later, in August of 2008, August 9th to be specific, I was at a professional friend's home at a memorial dinner party. I was there 5 minutes. I was told by my wife, Edie, because I passed out and went into cardiac arrest. And thank goodness I was talking to someone who knew CPR. They started chest compressions, called 911. The paramedics got there. I was told in about 4 or 5 minutes. Edie said I was shocked 7 times to get return of spontaneous circulation. I remained in a coma, went to Roseville Sutter Hospital in California. We were near there, and pretty big eye opener. Of course, I'm in a coma. So they did an angiogram. My arteries were clear. I arrested again in the cath lab. So I had to be resuscitated. I spent the next day with hypothermia in a coma another 3 days and left the hospital about total 10 days. I had to wait to get an internal defibrillator inserted. So, that's a pretty big eye opener. You save someone's life, and then a year later, do you have cardiac arrest? I was kind of shocked. My cardiologist said somewhere in the gene pool, someone's had arrhythmias, and that's why you had this arrest. You're pretty fit and eat well and blah, 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 never smoked. So anyway, we started getting thoughts like, what are we going to do? This is life-changing.
Yes.
1 minute you're dead, literally clinically dead.
Yep.
Then you're brought back to life with CPR and defibrillation. And we had a good friend from our church, and I met with him, and I said, Tom, I got to do something, man. We got to give back. We got to pay forward. So he connected us with the mayor of Danville, California, where we were living. And ironically, the next day, I got a call from, his name is Newell. And he goes, what are you doing tomorrow morning? I go, nothing. I'm just walking my 4 miles a day. They wouldn't let me return to work. So anyway, we had coffee, and ironically, he had a heart attack on August 9th in 2004, which was 4 years prior to my cardiac arrest.
Exactly. Yeah.
I mean, is that ironic or what?
Yeah.
So then we went to, I was a guest speaker the next Friday at his town meeting, and I met the fire chief and the battalion chief, and we became part of their public access defibrillator team, and later turned into a heart safe community. It was a place where I could let my hair down.
Right.
We didn't know that we were suffering from pretty significant PTSD. So I could tell my story, and it was okay to cry. These people were I had a safe place. And we convinced everyone on this group, there's 10 of us, we got to teach as many people as we can CPR and how to use an AED. So we were responsible with our group over a period of 10 years of putting over 120 AEDs in all of our schools, training over 40,000 people in Contra Costa County, California, hands-only CPR and how to use an AED. And we continue to do that here in Incline Village. We just got home now from teaching 50 people at our rec center gym. So the idea is paying forward.
Important work. Yeah.
It is. And the survival rate in Contra Costa County and during that 10-year period of time of witnessed sudden cardiac arrest went from 19% to 68%, which is almost unheard of.
That is unheard of. They always say that Seattle is the bellwether.
Well, Seattle's a little higher. They're 75.
Oh, I thought they were in the 40s.
Yeah, they're up a little higher, I think.
Okay. If you're doing comparable to Seattle, that's very impressive.
Yeah, the sad thing apart is when we left, our committee kind of disbanded 7 years ago. But we're carrying it on where we live now and continue to pay forward. And I'm very proud to be the chairman of the Sudden Cardiac Arrest Foundation, working with Gina and our board of directors, who are incredible people. And we're going to carry the mission on. We have to save lives. And one of my mantras before I die is I want to make sudden cardiac arrest a household word like heart attack. So I don't want to take any more of your time, Maria. I think I've probably spoken enough, and you did say that a probing question here and there. So I'll give the floor back to you.
Well, that is more than welcome. I have a lot of questions for you, but I think the first one for our viewers who are tuning in, just in case there's anybody here who is not familiar, Joe, could you just quickly explain the difference between a heart attack and cardiac arrest so that
Sure.
we're all on the same level set?
Yeah, it's you got to listen carefully. A heart attack is a plumbing problem, and the patient rarely loses consciousness, is able to communicate with you. And they have symptoms such as severe chest pain, arm pains, back pain, shortness of breath, sweating, nausea, but they're conscious. It's still an emergency situation where one should call 911 with these symptoms and get taken to the hospital. Don't drive your loved one or friend to the hospital, because 70% of people that have a heart attack, their heart stops beating, they pass out and go into cardiac arrest. So that's an electrical problem. It can go from a plumbing problem to an electrical problem. And you're going to be on a freeway and they go into cardiac arrest, the person will die. Every second you don't start, every minute you don't start CPR, get defibrillated, there's a 10% greater chance of dying. So cardiac arrest, you just pass out. Boom, you're down. And it's an emergency situation.
Yes, it is.
You have to assess this patient if they're breathing. If they're not responsive, don't try thinking, oh, is it a diabetic coma? Oh, is it an allergic coma? No. If they're not breathing and they don't move, they're likely cardiac arrest. So call 911, get an AED, and start chest compressions, and don't stop until the paramedics tell you to stop, or a trained medical professional. So, really the whole thing is the big differentiator. Heart attack, you have signs and symptoms of severe, and you're conscious. Sudden cardiac arrest, electrical, you are out cold and there's no pain. I don't remember 6 months before my arrest or about a week after.
Wow, that's amazing.
Anyway, I hope that explains it well enough for everyone.
Yes, I think so. I like that comparison. Heart attack, plumbing, sudden cardiac arrest, electrical. That's really good. You've mentioned your wife, Edie, a few times, and
Right.
I'd like to speak to her. I know, not speak to her, but talk about her and get your perspective on what she was going through. I was at a presentation 2 years ago where they talked about co-survivors, and this was at a conference by the Cardiac Arrest Foundation. And co-survivors, I think, is a great term because they're going through all of this with you as well. So tell me a little bit about Edie's, what happened with her as she's taking this journey with you.
Well, it's pretty profound. I think this term really evolved, and some of my resuscitation science friends can beg a difference with me, but Edie and I spoke at an American Heart Conference called Scientific Sessions in 2017. And that was 9 years after my event. And I learned, we were preparing for that. Edie kept saying, I'm the co-survivor. I mean, I'm the one. I was there every morning at 5 o'clock for 5 mornings where you were in a coma. I mean, I'm chasing down the cardiologist and the head nurse and the hospitalist and this and that and trying to find out. And my wife's a former ICU physical therapist, respiratory physical therapist. So she knew the scenarios. Within 72 hours, I'll be dead. The second scenario is I'll be mentally, cognitive impaired to the point, and physically impaired. I'll be in a long-term care the rest of my life. The third possibility is that I'll have short-term issues mentally and cognitive and be in a short-term nursing home or something. And the fourth is I'll go home with an intact brain and physical awareness and an ICD in my chest. So can imagine if you had that, and she'd already arranged for me to go into a long-term care. This is all within 3 days, or a short-term care place. And when I came out of the coma and started coming to, it took a day or two to come to. She realized, oh my God, he's going to make it. And the doctor said the first 72 hours is the most important part. So anyway, this was like Edie pistol whipping me, prepping for. Sorry about the tough analogy there. But it really felt that way to me personally. Hey, you're not the hero. You survived. I had to be there every morning at 5. I love you, but I made a lot of decisions when you were incapacitated, and so did our adult daughters. So the co-survivors, if it wasn't for Edie and my daughters and 3 or 4 couple friends of ours, it would have been a really rough recovery. But I think the co-survivor, and Edie spoke at this American Heart Conference. There was about 2,000 people there. And there wasn't a dry eye in the house. We were the first group speaking that morning. And she, the rest of the weekend, couldn't even go to the bathroom without someone saying, hey, what about this? What about that? So I'm real big on the co-survivors and aspect of the recovery, the 6, aspect of the chain of survival.
Yep.
Anyway, if it wasn't for her, I don't think I'd make it, even to this day.
Well, I have to tell you, one of our viewers just wrote, "Amen, Joe," and give him the thumbs up there.
Yep.
Gina, I'm intrigued by something that Joe said about communities, how he was able to get his community up into the 60% for responding. Let's talk about communities, because you have some expertise there. How can they better prepare to respond to sudden cardiac arrest?
Yeah, I think I'm going to go back to our ready to respond tagline: learn the facts, gain the skills, and save a life. And, I think that a big piece of being prepared is being educated and knowing the information, right? And so one of the things that we do is we share a lot of statistics and work to dispel a lot of the myths and misconceptions about sudden cardiac arrest, so that people understand the reality and understand the urgency of the situation. So, thinking about sudden cardiac arrest having near, on average a 10% survival rate, just the importance of the urgency of knowing, how to intervene and what to do. And also, I think for many people, it resonates when we share that, and this was mentioned before, the statistic that 70% of sudden cardiac arrests occur in the home. So chances are, if you are going to, help save a life, it's likely going to be somebody that you know and love and care about, so just being able to learn and be prepared for your, for the benefit of your friends, for your family, to do it for those reasons too, I think is really helpful. And then, I think the other statistic that we can call on is, that only about 40% of out of hospital sudden cardiac arrests receive bystander intervention before EMS arrives. And so this kind of goes into the second part of our motto: gain the skills, so for people to really understand and feel confident to take action. And there's a lot of hesitancy sometimes among people to feel confident stepping in, because they're afraid they're going to hurt the person. They're afraid of, not knowing how to do it correctly. They're afraid of, they think that somebody else would be better equipped to do it, so they're going to stand back, So we always share, that CPR, again, like practicing the skills, like knowing how to do compressions, knowing that an AED is pretty simple to use, that it gives you verbal prompts, and it kind of walks you through the whole thing, and that an AED is not going to shock somebody if they don't need it, So I think, for us, it's always important to share that, doing something is better than doing nothing. And if somebody is in sudden cardiac arrest, you're only going to help them, right? Like, you are their lifeline. So just having the courage and the confidence to know what to do and to take action quickly, because minutes matter, seconds matter. And so just having that, kind of awareness and sharing that is something big that we do.
Yeah. Now, recently, the Red Cross has really stepped up its partnership with the Sudden Cardiac Arrest Foundation. How does the foundation collaborate with organizations?
Yeah, we are so grateful to have you as the American Red Cross as a great partner. I think we're grateful for all partnerships and opportunities to collaborate. I think that there's strength in numbers, and I think ultimately we all share the same goal, right? We're all looking to save lives,
right,
prevent death, and I think that there's, collectively we can have such a greater impact with sharing information through each other's, collective resources, sharing, being able to reach constituents of each other with this information. And it only amplifies the message. So I think, for us, we love to partner with you and other allied organizations. We sit on different task forces and coalitions. We're a member of the Smart Heart Sports Coalition as well. So that is a great opportunity for us to work with other allied organizations. One of the things that we're working on right now is amplifying the AEDs for Youth program, where youth serving organizations and schools can have access to AEDs at a reduced price. So just really thinking about how we can collectively leverage our resources and reach more people and lower the barriers of people getting the information or having access to, tools and resources that will ultimately help save lives.
Right. We have a question here from Lydia, and she asked, and I don't know if we're able to, give a definitive answer on this call, but she wants to know how she might be able to obtain an AED for her church. Is this something that you can? I know the Red Cross also has the ability to facilitate the sale of an AED, but do you also do that through your organization?
So we work with different partners who, so we are able to offer discounts through some of our partners as well. So we can certainly share that information from our website.
Right. And, on our website, you can go to redcross.org/AED. I can't remember. Desley, our producer, will check if it's /AED or AEDS, and then she'll drop it back into the chat box as well. So, Karen, no, not Karen. Here we go. One of our LinkedIn users, Joe, had a question for you, which is, she may have missed it, but what is the cause of your sudden cardiac arrest? Did they ever determine it?
Well, initially it was idiopathic. And 70% of those who have cardiac arrest, the diagnosis is idiopathic. We just don't know. From my background in research, I did literature search through virtual libraries and found 6 months later, after my arrest, of course, after reading all my chart notes from the hospital, 10 days, 400 pages, I kept seeing, well, why did this healthy 56-year-old man potassium drop out, which can cause cardiac arrest? So there's a research study in the journal Circulation, and 6 months later, and they studied 20 blood pressure medications, and I had a family history of hypertension, was on a medication called Monopril. That medicine was taken off the market after this study because 1 in 500 people would drop potassium to cause cardiac arrest. I sent that article to my cardiologist as soon as I read it. He called me and said, that caused your cardiac arrest. For one of the reasons. He said the other reason was probably stress. I had a very busy, my wife and I, private practice. I worked 50 hours a week or more with very complex chronic pain patients. So that was the two variables he thought might have caused my arrest. So I move on.
Okay.
I'm not hell bent to if it was idiopathic, but that's the way it is. I got to move on with my life and pay forward.
Well, and you absolutely have. We're coming up on the bottom of the hour, but I do want to ask another question of Eugenia, which is, how can we have a lot of individuals here who have joined this live event and are interested in probably in doing more. What is the foundation? Is there a place for them in the foundation? And if so, what is it?
Yes, absolutely. So I would love to invite anyone who's interested in joining our cause to join us as a Heart Champion. And HEART is actually an acronym for Hero Empowering Action. Action, readiness, and training. And so these are people who are raising awareness locally in their communities, in their regions, in their states. We have over 200 champions signed up, and we just launched this program a couple months ago. So we're really excited about it. And we have lots of different resources for champions to implement in their communities. So we have a champion toolkit where there's downloadable resources, there's a customizable presentation, there's flyers, handouts, templates, lots of different resources that you can use in your community. And we are also always happy to develop resources, with you if there's this particular The only requirement is that you are interested and passionate about raising awareness. And so we are happy to have you and welcome you and find different opportunities. We have lots of different projects that Heart Champions are able to work on depending on their interests and their skills and time and everything. So we would love to have you join us in that. We're actually also celebrating, I should have mentioned this earlier, our 20th anniversary for the foundation. And so, we are certainly proud of the work that we've done in the last 20 years, but recognize that, there's more to do in the next 20. And so we also have a document on our website with 20 suggestions of how you might be able to get involved and support our work. And so I would welcome anyone who wants to learn more to visit our website, which is sca-aware.org. Sign up for our newsletter, join us on social media. We have lots of ways that we're raising awareness, and we'd love to have you join us.
Yep. That URL is also, our producer just put it into the chat boxes, so you can see it there. I do have one more question that came in. It says it's from Mark, and he would like to know if there are any studies on bystander willingness to engage with hands-only versus traditional CPR. So,
I'll take a stab
Gina,
at it.
Joe, great.
In 2010, the AHA guidelines came out with research that showed that traditional CPR with compressions and breathing versus hands-only CPR, they were equivalent in outcomes. And so since 2010, there's been a big push to get more people to step up. And that's where the advent of hands-only CPR came and how to use an AED. As I said earlier, my wife and I and our group back in the San Francisco Bay Area trained over 40,000 people in this. And the survival rate 5 times greater in 10 years. So specific evidence about willingness, it's really anecdotal from my opinion. I mean, most of us aren't going to want to put our mouth on someone else's mouth we don't know. And I think that there is research out there, I know, that shows that the hands-only CPR, people are much willing to step up and save a life. But I'd have to do a literature search for you, Mark, to find that out. I'm giving you anecdotal data or,
Right.
or communication. But from my experience, I think people are much more willing to perform hands-only than to do traditional CPR with breathing.
Yeah, and it's easier for somebody who hasn't had formal training.
Exactly.
You can still save a life, and you are a critical part of that chain of survival for cardiac arrest. Okay, we're at our time. Joe, Gina, any last words? I'll toss it to Gina first, and then we'll go to our survivor.
Again, I just wanted to thank you so much for your partnership and the opportunity to join you today. I'm grateful to connect and look forward to continuing to working together. And for anyone who's watching us today, please join us in this work. We'd love to have you join our mission. Thank you.
I'd just like to thank you, Marie, and American Red Cross for setting this up. It's a very huge honor as a survivor and chair of the Sudden Cardiac Arrest Foundation to be part of this event. I don't know the background of all the participants that listen, but I want to thank you all for taking a half hour or so out of your life to listen to us. And I hope we enlightened you and motivated you to help us raise awareness of sudden cardiac arrest in this country and the world so that it becomes a household word. Not just, people don't know what it is. I trained 50 people this morning, my wife and I, at an event here in Incline Village, and I'd say 75% didn't know the difference between a heart attack and a cardiac arrest. So please help us be advocates, help us educate, help us with awareness. Thank you. Thank you. Thank you.
All right. And if you do want to take a training class, please just go to redcross.org/take a class, and you can find one near you. So thank you, Joe. Thank you, Gina. And thank you to all of our viewers.
Thank you.